75% of people still say they trust physicians. And that number sounds great in today's world, but in 2020, that number was 90%. So we are eroding that trust. And I think as we start eroding trust, I worry about how they access healthcare and how that elevates disparities. And so I think the area of trust in healthcare has been one that I've really been worried about and thinking through, but I have seen an erosion.
Today's PSA highlights Dr. Jahangir, an exemplary healthcare leader and hero renowned for his innovative approaches in addressing critical public health challenges, including COVID-19. As an esteemed orthopedic trauma surgeon, Dr. Jahangir's unwavering dedication to healthcare is palpable, exemplifying his commitment to providing exceptional care to patients from all walks of life. My name is Dr. James Hildreth, and you're listening to Public Service Announcement. To learn more about this show, or to learn more about Meharry Medical College, visit www.mmc.edu. Dr. Jahangir, welcome to the show. And can you introduce yourself and tell us a bit about your background?
Yeah, thank you so much, Dr. Hildreth, for having me. My name is Alex Jahangir. I'm a orthopedic surgeon by training, by my day job. In fact, I do trauma surgery specifically. And I'm a guy who was born in Iran, and my family, when I was 6 years old, moved here to Nashville. And I'm a product of this great city in which we live. My father actually did a residency and ended up working at Meharry, went to high school down the street from Meharry. So Meharry Medical College is obviously somewhere that's very special to me and my family. But I grew up here in Nashville, then went away for all my training and came back about 15 years ago where I joined the faculty of Vanderbilt as an orthopedic trauma surgeon. And so that's how I came back to the city. And through happenstance and a lot of things that you and I will probably get into, I came into an amazing position to be chair of the Board of Health in the city of Nashville. So an orthopedic surgeon who came into the city with the intention of, I kid you not, my research and academic work was going to be around what screws hold bone together best. And I went from that to leading the public health department and eventually the pandemic response in conjunction with you and others. And so that's a very quick nutshell of who I am.
Thank you, Alex. Can we start by first talking about the erosion of trust in the healthcare system?
Yeah, this topic of trust in healthcare is one that's been permeated throughout my 20 years plus as a physician, and I've only really started paying more attention to it, I guess, as I've gone into healthcare through COVID and actually before COVID. So as I mentioned, I'm an orthopedic trauma surgeon. So people who interact with me have no idea they're going to see me the morning they see me. 90+% of my patients are involved in accidents, sometimes victims of crime, sometimes violence, sometimes falls. And they come in and they're in the most vulnerable moments of their life. Literally, their leg may be dangling by a few strands of tissue, and I ask them to trust me to put them to sleep and to do the most crazy surgeries to get them back to recovery. And I started noticing as over the past many years, I noticed that patients of mine that would recover better than others typically are those that I had a rapport with, irrespective of socioeconomics. It was a partnership, and I started diving into, gosh, what is it that makes that different? And I realized that the foundation of it was trust. And so as I focused on it as a surgeon, it was always very top of mind for me, and I try to teach my residents. Over the past 5 years and 4 years really since the pandemic, what I've noticed is healthcare has lost that specialty. And one thing that I think was actually very humbling and one thing that I never really fully appreciated until now is the moment we enter medicine or nursing, but med school, you get that white coat ceremony, society gives you this level of trust and you're kind of put on a pedestal, whether it's undeserved, frankly, immediately, but it is. It's the reality it is. And most of us appreciate that and respect that. Over the past 5 years specifically, if you notice, the Pew Center for Research did a study in which 75% of people still say they trust physicians. And that number sounds great in today's world, but in 2020, that number was 90%. So we are eroding that trust. And I think as we start eroding trust, I worry about how they access healthcare and how that elevates disparities. And so I think the area of trust in healthcare has been one that I've really been worried about and thinking through. But I have seen an erosion.
And of course, we've known for a long time that if a patient trusts their physician, they're more likely to get the prescriptions filled and follow the instructions they're given. So I think your point is well taken. But how does an orthopedic surgeon become interested in public health in the first place?
Well, it's a superb question, and one I asked myself many of times. But the gist of it is, I think most of us enter medicine for a desire to help people. I suspect that probably was a drive for you.
Yes.
I know it's probably a drive for the thousands of students you have educated, and in my world as well. But what I realized is the impact that one can have in a society around health. It was neat to do that one-on-one relationships. I still to this day cherish the relationships I have with my patients who I'm on call tonight. And so tomorrow I'm going to meet somebody for the first time, and I hopefully will impact their life for the rest of their life. But I realized the impact of public health, and what public health is for the listeners, you think about a community, how they live just healthier. And just maybe a very simple way of putting it. But I realized that the impact of policy, the impact of thinking on a communal level can impact tens of thousands of people in a decision and in an action. And that it has been very neat for me, especially, again, the desire of wanting to help people, which, again, I suspect everyone I've ever met. And so that's what initially got me interested in it. The way I first approached it, though, was in the world of orthopedics. And I began my academic career right around when the Affordable Care Act became a thing. So the Affordable Care Act wanted to give more health care access through insurance to a majority of Americans. Nobody in the world of orthopedic surgery was thinking about it. A lot of people in internal medicine, a lot of pediatrics. But in the world of orthopedic surgery, and if you think about it, most people have an orthopedic-related matter. Your knees hurt, your hip hurts, you break something.
Right.
You can't do sports. If you don't have good orthopedic health, you often will have worsening health in other things. In fact, if somebody falls and breaks their hip after they're 80 years old, within 1 year, 20% of those people die.
Oh, wow.
So I tell you that to say nobody was talking about the impact of access to care in orthopedics. That became my shtick just very academically in the early in 2010 and from there I then had opportunities within our city to engage with our public health department.
Well, that's amazing. That's a great story, Alex. Now, of course, you and I are connected forever in our service to the city during the COVID-19 pandemic, and I just wonder, how do you think the pandemic itself has further eroded trust in the healthcare system, or do you think that's the case?
Well, yes, I do think that's the case. So here's what I think has happened, Dr. Hildreth. We'll talk about COVID and maybe broadly over the past 5 years. So I think there's probably two or three main reasons I think we've eroded trust. One is people in today's world, they look at experts, and I'm air quoting for those who obviously can't see, and they expect experts to have the answers right away. And, in the past in medicine, if I told you, hey, if you exercise, you'll lose weight, and that happens, you trust the physician. In COVID, experts like yourself, national experts, and individuals like me who had the opportunity to speak about COVID, we were learning in real time. And so one thing we might have thought 3 weeks prior that we said would change. And science by nature is an evolution. And ideas change. And as we get more facts, we inform with the correct facts. I think a certain percentage of society saw that evolution of science and teaching as more of a reflection of, hey, they don't know what they're talking about. I don't need to trust them. Rather, I'm going to trust the guy or gal who really knows what's going on, which unfortunately typically is somebody on TikTok who is speaking some crazy truth, right? And so that was one. Then I think we have, again, historically in society, we look at our leaders in moments of crisis. I remember after September 11th, President Bush, how many people came around what he said, and we listened to him, and we believed him, and we were inspired by him, irrespective of your political background. He was inspiring. I suspect that's how it was felt with Roosevelt during World War II. We didn't have that kind of leadership, and I'm not just speaking purely about President Trump, but in all levels of leadership struggles, we didn't have leadership that says, hang in there with us. We're going to get through this.
Right.
That helped in people losing trust in the system, and not just healthcare, but system as a whole. We also had erosions in you're in America and you couldn't get supplies. You're in America and you couldn't get medicines, couldn't get ventilators. That's not the America we grew up in.
That's right.
And then I think people became a little bit more agitated at each other, period. The things you saw about people yelling at each other around masks and about schools, valid or not, the erosion of civility, I think, has really gone into. I see in my clinic, somebody comes in and gets mad at my front desk staff. A little bit more typical than usual, more often than it has been. And I think that person has lost some trust in our system because let's say their appointment was moved or they wait 2 hours and they've done everything they need, but they can't find their insurance card. We as a system need to do better to re-secure trust, but little things like that erode trust. And I think so COVID and then continuing in our health system has resulted in that.
I agree with everything you've said. And I also think that somewhere along the line, we've lost the trust we used to place in science and scientists. And that was reflected in the pandemic as well. But you wrote a book that sort of chronicled your activities during the pandemic, which I had the great fortune of writing the foreword for, Hotspot. So what inspired you? It's a great book, by the way.
Thank you.
Inspired to write the book.
I never thought COVID would last as long as it did, number one. When the pandemic began, I had this really amazing opportunity to serve as the chair of the task force for the city. About 6 or 9 months before, my wife's grandfather had passed away. He was in England. He was a World War II pilot. I had never met him. He had dementia. But when he passed away, my mother-in-law pulled out all these letters he had written to her mother during World War II. And I read these letters, and this person I'd never met, I heard his voice, and I saw what he was going through during this time. So when the pandemic started, I had, at that point, a kindergartner, a first grader, and a third grader. And I figured this would be a couple months at the most. And I thought what I was doing, very quickly, it became evident we were doing some amazing, neat stuff. And honestly, I just every day had a little notebook in my home office, and I would just write number of cases, number of deaths, what the problem was that today, what we did, and what the immediate outcome was. Never at all thought anything about, besides I wanted them to find this book one day and show it to maybe my grandkids. A year and a half into this, I kept this journal every day, and I'm not a normal journal, right? To this day, right now, I don't keep track of my day-to-day anymore. It's just during this time. I just happened to mention it once to some of our colleagues that are helping us with media, and I was like, man, I went through, and I initially mentioned this just to be a pep talk.
Yes.
I was like, team, look at what we've achieved, and I started reading some of this stuff, and one of the very astute media people were like, wait, you kept a note? I'm like, yep, and we started talking about it, and at the end of the day, the message of wanting my children to have a record of what I did was the primary objective of why the book came. I wrote the book. Fortunately, it was able to be published, which is really humbling. It's a neat process. But secondarily, Dr. Hildreth, is I want the world to remember what happened in real time. There probably is now lots of books that look retroactively about what happened and the good and the bad. I want people to know what we felt in that moment. The city of Nashville in that one year, it's more than just a COVID book. It's really about the city of Nashville. I dive into this year. We had the tornadoes, COVID, the pandemic. We had the bombing. I dive into the history of Meharry Medical College. It's about my high school, the MLK, Chief Will Swan. It's really a story about Nashville, the community that's given me so much. And I'm humbled that the reception's been so amazing. But at the end of the day, if I'm selfishly going to admit it, it's just so my children would be able to look back at it one day and see what I did.
I think we're all fortunate that you did this for your children, because it does capture what was happening in Nashville in a way that I think few others could have done that. So we really appreciate that.
Thank you.
I also appreciate the stories about Meharry and the role we played. So we really do appreciate it.
Well, I think one can't underestimate and understate the role that Meharry Medical College played in our city's response. You specifically for the country, but your team and just for the listeners, I don't think people realize for 118 weeks, the people of Meharry Medical College, your staff, your leadership team allowed 400,000 free PCR tests to be conducted, which kept our hospitals from being overrun, allowed people to get care. Then it transferred to providing vaccinations to tens of thousands, 25, 30,000 people in our centers, plus what I'm sure you did at Meharry Medical College. And the stories you hear about people building confidence and trust. So we're talking about trust. I would walk those testing sites regularly, and I could see people who had trust in the system because of the people there. They might have not trusted what I said on TV. They might have not trusted you, but they trusted those individuals working the front line. In fact, some of the people who received services ended up volunteering in those lines.
That's right.
And I think it's a statement. It's not my statement. And people don't care how much you know until they know that you care. That was reflected by the people who staffed those testing sites. And again, I appreciate you as the leader of the organization willing to say, let's do this. And we did it. And I'm sure it caused a lot of pain within your organization because you had to pull staff from other responsibility.
Right.
But man, that is an example of how partnerships can work. And I hope people really not forget that.
Yeah, I was really proud of our students who took part, our staff, our faculty. It was really a great moment for Meharry to show what we're made of and what we do every day.
And what you've done,
Yeah.
right? I mean, from the 1800s.
Yeah, so since 1876, we really proud of that legacy.
Yes, sir.
So what lessons have you drawn from that experience that you now sort of incorporate into what you do in your daily job?
Oh gosh, there's so much. This is probably too short of a podcast talk. Here's one that I really that really has stuck with me. It's to ask the question of why. I sometimes see patients who are not in the best moments of their life because of choices they've made, whether it's drugs, alcohol, a life of violence. It's really easy, and I've seen it. I'm not proud of it. I've seen it. I can't say I've done it, but I've seen people, my colleagues, blow off a patient who's saying, my leg hurts, or or they're getting very sick because they injected a drug somewhere, and we maybe take care of them, but then really ask the why of why they got there and see how we could get to the root cause. I didn't have that patience as much before the pandemic. The reason that's changed for me is during the pandemic, there's a lot of people who wouldn't get vaccinated per se. During a snowstorm, we were able to have 200 vaccines that the state needed us to distribute. And you may remember we founded a small clinic in Jefferson Avenue, and at that time there was people 55 and over lined up in the snow.
Yes.
And it took about an hour plus to get people through. And about 45 minutes in, this woman who was, she's probably in her 60s, 70s, maybe 80s, waiting in the line this whole time, got to the front of the line and said, I don't want this anymore. It was so easy to just say, okay, whatever, we have 20 other people behind you, let's move on. But one of the people who were doing the vaccines saw me and said, hey, can you come speak with her? And I just asked this woman, I was like, I'm just curious why. Previous Alex would have said, look, fine, just move on. But I asked the why, and her why wasn't that she thought we were putting a microchip in her, wasn't that, she heard something. She was a person who came from generation to generation before, had some horrible things. She was African American, horrible things done to her neighborhood,
right?
Experimentation, lack of health care being provided intentionally to them. So she had her why was she didn't fully trust what we were hustling, for lack of a better word, in the vaccine. And when I just took a minute, it wasn't a long conversation, and we just asked the why. And it wasn't just me. The 5 people behind her in line who heard this conversation, because it wasn't a private room, they helped ease her. These are people who are her colleagues, her mentors, her peers, her neighbors. And so she got the vaccine. Now, that story it's a nice story by itself, but what was really neat, Dr. Hildreth, about 2 years later, I was by the Lentz Health Department. She happened to come in to get a birth certificate of her grandkid or something. We crossed paths, and she remembered me, and she brought this up, and we talked through it even further. It's taking that minute to ask the why. It is really easy in our world today to just place people in bucket A or B, and if they don't believe or think like you just blow them off and say they're not smart, they're ignorant, whatever word you want to use. I think if we take a second to ask the why, not just in healthcare, but across, I think there'll be a lot of forward momentum we can make. I've gotten better at asking the why, and that came directly from the pandemic.
Oh, that's a great story, Alex. One of the things I'm concerned about is when you go see your provider, you have, 15 minutes, and for a lot of them, they're focused on their tablet and the boxes they have to check, and not so much on so they seldom ask why, as you point out. But it's so Alex, if you don't mind me saying. But how does listening to patients' concerns and acknowledging past, injustices contribute to building trust?
Well, again, I go back to that statement, people don't care how much you know until they know how much you care. Another thing, if you hang out with me long enough, and it's a stupid statement, but I often tell people, I tell my residents this a lot. I said, people aren't stupid. Like, people know when you're being sincere and when you're not, irrespective of their educational background. They're part of that dialogue in that short time frame is you just hear people out for a second. I'm not talking 3 dinners and hours of life. ask them why they're there. Ask them what concerns they have, what misconceptions. Or I had a patient actually in clinic yesterday who he had a deformed leg for 10 years. 10 years. This gentleman, his leg was crooked. He had broken it and it was crooked. And then he comes in and I'm the third surgeon he saw, and his mom literally, when we scheduled surgeries, looked at me and one of my colleagues was there and said, almost like she was going to cry. She's like, I really appreciate you guys not blowing us off, because every other person, when they heard it had been 10 years, didn't ask why did you wait 10 years? And they said, this guy, obviously there's some secondary gain he's trying to get here. He's trying to get 10 years. And this person had gone to 3 doctors to try to get his leg straight. And my first impression is probably that as well, is what's he trying to get here? But when you sat down with him for just a few minutes, you realized that he was now in his 30s. It was getting harder for him to work. His parents were getting older. His why was he just wants his leg not to hurt as much anymore, and he knows he's got a good, hopefully 40, 50 years ahead of him, and he understands the implications of what breaking his leg and straightening it and stuff mean. And so we scheduled him for surgery. And it's just taking that minute.
I wish more organizations were replete with physicians like yourself, Alex, but how can organizations, not individuals, cultivate a culture that promotes trust and engaging patients the way that you do?
I think it's such a great system, because I think the only way you're going to scale and rebuild trust in healthcare is not one-on-one, right? It's as you said, it's some things are as easy as the operational things. How easy is it to get access to your system? If I pick up the phone and call, will somebody pick up on the other line and quickly get me in, not 6 weeks from now, but within a few weeks or a few hours or days or whatever? I mean, I know these sounds trivial, more like operation stuff, but operations matter. When I go in, will someone look at me and smile and say, hey, thanks for being here. What can we do for you? Or will they look at you and kind of huff and puff under their breath because you're just another cog for them? Do you as an organization respect somebody's beliefs? I have several patients that come up that don't want blood products. Do I, when they tell me they don't want blood products, when they're literally, their leg is dangling and I'm about to take a big surgery, say, well, you're just going to die, which I've heard people say? Or do I say, okay, I respect why you're telling me that. I will respect your wishes, understand there's a higher risk. And that conversation I've had maybe 100 times in my 20 years. And every time people are like, people get it. Like, they have strong faith, and they see that I respect their beliefs. I've had multiple people who don't engage with pork products, have that conversation with me. And the first time I'm like, this is nuts. But instead of saying that, organizations that provide information to their providers that, hey, you may have somebody who is a very devout Jewish person or a Muslim person that doesn't want, and by the way, these drugs are made of pork products. When they tell you that, so being proactive in informing your providers of things that you may not be aware of is another way that organizations, institutions can help build that trust.
Well, one of the other concerns that I have is that technology is making it more and more difficult to connect with patients, because ever since, Rene Laennec invented the stethoscope back in 1816 to separate himself from the patient, it looks to me like technology has been making more and more separation. So can you imagine a way that we can use technology to reverse that trend, if at all?
I think it's really neat. As you know, there are now technologies that we have now, over the past 10 years especially, have gotten to a point, as you mentioned earlier, the provider puts a computer in between them and the patient, has to click buttons.
That's right.
And has to click buttons not necessarily for the story, rather the billing purpose. Technologies now are out there where perhaps the conversation can be listened to by a device, and that device will take the key points and put it into a note, and that note can be used for the purpose of the story of the injury to the story of the billing, and perhaps written in a way that it can be a summary for the patient in real time.
Right.
So, I think we do a great job at Hildreth, and we being people like you and me who live in our ivory towers and have the title of professor, of being very professorial. And we use big words, and we and we write really neat papers, and people like and we go to our fancy stuff and meetings, and let's be honest, and I say that with respect, of course, and you go to much fancier meetings than me. But at the end of the day, I need to be able to provide something to that person that their high school kid or maybe even their middle school kid can read, so that maybe their kid can help them with their blood thinning medicine or how much weight they can put. And I think technology can now perhaps help us take these fancy things you and I do, make it in a way that's disseminated in a way that a majority of people can understand.
I think Vanderbilt is very fortunate to have you on their team, to be quite honest.
Thank you.
So there's one last question I'd like to ask you, which I ask all of the guests. It's like a call to action. So what steps can stakeholders in this world that we're in take to collaborate in rebuilding the trust in the healthcare among the people who seek us for their care?
I think step one is recognize that there's a problem. I think a lot of us still say, if I told you 75% of people trust us, you'd say that's pretty good. That's not good. It's not good. It's eroded. Number two, be proactive about building this trust again. Make sure your systems are such that for the moment the patient engages with your system, they feel welcomed. That includes your people answer your phones, your front desk staff, your clinical people who bring you back. But then when you sit with the person, take a moment and just look them in the eye and engage them. Ask the why and understand where they're coming from before you dictate to them what you think is what the ivory tower tells you it is.
Thank you, Alex. This has been a great conversation. And again, I think that your organization is very fortunate to have you in a leadership role. So thank you.
Thank you for your time. Thank you, sir.
Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit www.mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.